Welcome to Expanding Access, a podcast by Behavioral Health Tech, where we explore the cutting edge of mental health, substance use, and autism and IDD care. Each episode features insightful conversations with industry leaders who are driving real change through technology and innovation. Whether you're a provider, payer, or just passionate about expanding access to behavioral health care, you won't want to miss these stories. Let's dive in. Hello, everyone. My name is Solomé Tibabu, and I'm your host for the Expanding Access podcast, where we focus on, of course, expanding access to mental health, addiction, and IDD services through technology, health equity, and innovation. Today, I have two incredible policy leaders joining us, Talisha Searcy and Kacie Kelly. Thank you so much for being here. To get started, why don't we start with a few introductions? Talisha, why don't we start with you, please?
Wonderful. Well, thank you so much for having me. My name is Talisha Searcy, and I am a senior advisor within the Assistant Secretary for Technology Policy. I work exclusively on behavioral health issues. And prior to a return to ASTP, I spent a few years working as the Office Director for the Office of Performance Analysis and Management within the Substance Abuse and Mental Health Services Administration in the Center for Substance Abuse Treatment at SAMHSA. So this is a topic that is very near and dear to my heart, and I am super excited about the opportunity to speak about some of the wonderful work that we're doing here.
Hi, thanks, Solomé. My name is Kacie Kelly. I'm the Chief Innovation Officer at the Meadows Mental Health Policy Institute, where we uniquely operate at the intersection of policy and programs. And as the head of innovation, I live, eat, and breathe all things behavioral health tech. So I'm just really delighted to be here with Talisha and you, Solomé, to talk about some of the exciting things happening in DC.
Wonderful. Thank you both. Talisha, why don't we start off by sharing a little bit about what is the Behavioral Health Information Technology Initiative, also known as BHIT?
Definitely. So the Behavioral Health Information Technology Initiative, or BHIT, as we lovingly refer to it, is a partnership between the Assistant Secretary for Technology Policy and SAMHSA, with the goal being to advance behavioral health adoption and use amongst behavioral health providers, but also to further behavioral health and physical health data integration. We worked with SAMHSA. SAMHSA awarded $20 million to ASTP for the purpose of addressing a few major components that we knew were challenges for SAMHSA's grantees. One being data standardization. So what are some of those data components that need to be captured within EHRs that are unique and distinct to behavioral health providers that currently are not standardized? Address some aspects of the adoption challenges, and we're doing that through pilot testing, but to more importantly, develop a toolkit of resources that can be used, not just for behavioral health providers, but also for physical health providers who also are treating individuals who have behavioral health needs in order to advance care coordination between these two care settings. So we have been very excited about the partnership that we've had with SAMHSA over the last year. It's a 3-year project. And our hope is that it will really serve as that foundational building block for advancing health IT adoption in the behavioral health sector.
Wow, this is a huge opportunity. And thank you so much for sharing that. Kacie, can you speak to why behavioral health data has historically been left out of mainstream health IT systems? And how does this address that gap?
Of course I can. And I also just want to say, Solomé is a little bit full circle. HITECH first announced this initiative that Talisha is overseeing and has been the driving force behind at the Behavioral Health Tech Conference a few years ago on a panel we put together. And so just really thrilled to be here today to sort of see where we are and all the progress that's being made. So historically, unfortunately, when a legislation was passed called the HITECH Act, that really is what was the driving force in requiring electronic health records to need to be advanced across America in health systems. Behavioral health tech was left out of that legislation. And there were a variety of reasons for that, ranging from funding to privacy. But at the end of the day, that has really been a significant barrier to having the infrastructure that Talisha was just talking about, that they're working to solve in place so that behavioral health systems who are operating independent from the rest of healthcare can integrate into these electronic medical records, or even within, traditional healthcare settings when practices and health systems want to integrate behavioral health practices and care delivery, it is still a barrier because of that infrastructure not being there from both the hardware, the technology piece, but also because the data, the language around the data and the governance and the standards are also not there. And so we're really excited about this program that the federal government has come together to launch, because it has tremendous opportunity to correct what was ultimately the result of behavioral health being left out of the HITECH Act 2 decades ago.
Super interesting. And Talisha, as we think more and more about improving care coordination and better interoperability, how do these initiatives fit into some of the larger goals that BHIT or ASTP have, as well as other federal agencies for that matter?
Yes. So one of the main goals of ASTP has been to free data for the purpose of improving care delivery, care quality, and efficiency and effectiveness within the healthcare system. And I've heard personally from behavioral health providers how the landscape for behavioral health clients has really changed. It used to be, I had one substance use treatment provider that said, hey, it used to be the case that people, unfortunately, who used opioids died younger. We're seeing people live longer now, which means they are, as all of us when we age, have additional co-occurring conditions that require coordination with specialists, with primary care physicians. And we even saw that during COVID, where there was a need when there are individuals that need to be in inpatient treatment facilities and a need to know whether or not they have been exposed or had COVID vaccinations and the like. So it has become increasingly important for there to be more information sharing between behavioral health providers and physical health providers, and that integration exists. But I've also heard firsthand from behavioral health providers about the challenges that they experience in terms of not having access to the resources to acquire the technology needed to engage in interoperable data exchange. I've also heard firsthand about the challenges that they have in terms of workforce and not having the staff available that can really think through some of these challenges in terms of what are some of the data that we need to make sure that we're able to capture? How do we communicate that to our health IT vendors if we have them? And what are some of the ways that we can make sure that when this data is captured and it's ultimately pulled out, it would help me, not just as it relates to billing and claims, but also for the various grants that I'm receiving from the federal government and to do the reporting there. So our hope with BHIT is that we can, as I've mentioned earlier, do kind of three core things. The first is build upon the United States data, the USCDI. And so what that is basically a core set of data elements that are designed to be standardized and exchanged across various sectors. What we're doing right now is the USCDI Plus for behavioral health. And what that really is just an extension. So the USCDI is a list of data elements that are standardized, that allows for EHRs to exchange data and kind of serves as that core information for interoperability. The USCDI Plus is where we identify unique sectors or unique spaces where there needs to be additional data that is developed and standardized for a unique purpose or unique use case. In this case, behavioral health, but we've also worked on things like public health and maternal health, really trying to think through for this specific use case, what are some of those unique data elements that are not standardized right now that would mean the world for those providers to be able to exchange and how can we identify those data pieces, develop the standards associated with them, and test in a real world way that they can actually be moved. So the big piece of this project includes the USCDI Plus for BH, and that's developing those data elements that are unique for the behavioral health space. The other component of this project is real world testing. So we are facilitating a massive pilot. About $5 million will go out to between 6 to 10 pilot participants for the purpose of testing the USCDI plus BH, exchanging across various partners that they have, but also so that we can take the lessons learned from the pilot and develop various resources and toolkits that can be passed on to providers at large that may be interested in adopting the USCDI themselves. So our hope for this project is that we are not only addressing some of the immediate needs in terms of putting resources in the hands of those pilot participants so that they may be able to acquire technology and adopt the USCDI in a way that would be useful, but also that we are able to learn from these pilot participants in a way that we can share more broadly to help other behavioral health providers and other providers across the care continuum that would be interested in ultimately helping to capture and exchange behavioral health data.
And how are you working with partners such as SAMHSA and coordinating with CMS and HRSA to ensure that USCDI plus behavioral health data elements align with their data needs?
Yes. So one, we are working hand in hand with SAMHSA in terms of making sure that we're thinking through provider needs, but also their organizational needs as it relates to grant reporting requirements, other data collection tools that they have that exist, and really trying to think through what are some of the data elements that if we were to standardize within EHRs would make your lives a little easier in that you wouldn't have the need to ask behavioral health providers to come up with all of these different approaches to reporting certain data to you. How could you ultimately leverage those data? But again, we don't work in a vacuum. And we've had conversations with HRSA, particularly as it relates to the work that they're doing on the USCDI plus for maternal health. One of the big populations that are often being served in the behavioral health space includes mothers, pregnant, postpartum women. And so what are some of the things that we can make sure that are captured within the USCDI plus BH that might relate to postpartum depression or maybe pertinent individuals who used illicit substances in the past and are pregnant and trying to navigate that space? What are some of those data elements that might be pertinent to their care that we could capture within the USCDI plus BH that could also be relevant as it relates to the child maternal health work that they're doing as well? We've also received comments from CMS on the data elements. So we've been really working across the federal government to really try to make sure, one, that we're socializing the project that we're doing, but also that we're getting that feedback from them in a way that would help us to refine the USCDI plus BH such that it doesn't just serve the purposes that we have with an ASTP or SAMHSA, but it could also fit the needs of broader programs and policy needs across HHS and beyond. So there's been a lot of coordination that has been happening to make sure that as we're moving this needle forward, that we're keeping in mind the other uses across federal government for these data as well.
And what kinds of technologies or tools are being developed to support all of this?
So because there's so much variation in terms of the vendors that some individual providers may be using or their level of technology maturity, we've decided to take a bottom-up approach to the pilot, where we are allowing pilot participants to propose technologies that they're hoping to use and the actual use cases that they want to focus on in terms of leveraging the USCDI Plus. We're not actually piloting a specific technology. What we're trying to do is allow our pilot participants to take the technology that they have and see if they can apply the USCDI Plus to that technology or to acquire technologies that work best for them, but use the USCDI and in terms of interoperable exchange with those technologies.
That's so great. And Kacie, what do you want our audience to know about opportunities that might be on the horizon to advance BHIT into behavioral health programs across America? And what do you hope comes out of these initiatives in the next 5 years?
So, that's such a great question. I think the biggest thing I want the audience to know is that we are seeing potentially massive shifts in how technology is going to be leveraged in healthcare in the future. And there's a specific focus on behavioral health technology is such a key component. There are policies that are being negotiated that are going to impact interoperability, that are going to impact the role of AI in behavioral healthcare delivery, as well as all of the BHIT program that Talisha was talking about. And savvy digital mental health leaders will recognize that this period really does represent an unprecedented opportunity for them to engage. And this administration has been really great about reaching out to the private sector to solicit ideas and solicit guidance from those who are out in the world trying to drive transformation and innovation. And Talisha was able to talk about some of them today, but just in the past 2 months, there's been 3 separate calls for information from the private sector, individuals, companies, organizations, where the administration is really trying to solicit what are the best and brightest ways for improving our technology infrastructure in healthcare and in behavioral healthcare specifically. And I'm also really excited about something that we've just pulled together that we've been thinking about for a while now as a way to help entrepreneurs and investors understand where and how to engage in these policy conversations and try to influence them. And so I'm really delighted that just this month we launched a new consultation service called Heads Up. That is the only federal advisory service that is being targeted and directed specifically for investors and innovators in behavioral health tech. And I'd love for people to reach out. We would be happy to share more about that service that we're offering. And you can find out more about it at headsup@mmhpi.org.
Awesome. Thank you, Kacie. And for our audience, I think that's just a really amazing opportunity. Everyone should follow up and learn more about that and how to get involved, because that's a really unique opportunity to get involved with policy and advocacy in this really important time for behavioral health technology. And thank you, both of you. This has just been such a great conversation. I wish we had so much more time, but unfortunately, we're going to have to wrap up soon. But I can't end until I can ask one thing, Talisha. We also know that you are the mayor of Tacoma Park, Maryland. On top of all the other work you do, what bright spots are you seeing in your own community?
Sure. So I will say that my role as the mayor of Tacoma Park, Maryland, I am the mayor of Tacoma Park, Maryland, but it doesn't align often or at all, quite frankly, with my role in ASTP. But I will say one of the things that many communities, including the city of Tacoma Park, has been facing is the need for behavioral health providers and access to behavioral health services. The workforce shortage is a major issue in many communities, and the community that I represent is no different. But there has been some bright spots in terms of how technology is really starting to bridge that gap. I'm seeing in my community where primary care providers are actually providing telehealth, behavioral health, telehealth suite areas within their practices to allow for people to come in and meet with their practitioners remotely. And what I've heard is that that's really beneficial, particularly for youth who are looking for private space to be able to have those kinds of candid conversations with their providers, and they don't want to necessarily do it at home in front of mom and dad. Those are some of the things where we're really seeing how that integration between behavioral health and physical health is starting to occur in a natural way. And with the increase in the use of telehealth in the behavioral health space, I see that only growing more. So that's just one example of some of the things that I'm seeing locally. But there's so much more. I know that there are a number of communities that are trying to navigate the space of 988 and including ours and how to do the necessary dispatching and how to leverage data to help facilitate that piece. So I think that now more than ever, the use of technology to improve access to behavioral health services, to improve care delivery for behavioral health for patients and that care coordination that they desperately need in the behavioral health space. There's a growing understanding of that value of technology. I think where we are now is really trying to help to tackle some of the challenges that other care settings experienced early on during HITECH, and where we are now, and I know ASTP is committed to, is really trying to help address some of these barriers that behavioral health providers are experiencing, and including the standardization of data, as well as trying to provide those resources that'll be even more critical as they are looking to adopt new technology.
Amazing. So impressive. Both of you, such incredible policy leaders. Thank you for joining us and sharing so much great information about what's happening with behavioral health today. Really appreciate it.
Thank you, Solomon.
Thank you very much.
Thanks for tuning in to Expanding Access. We hope you're feeling inspired by today's discussion. If you've enjoyed the episode, subscribe and share it with your network. For more content and opportunities to get involved in transforming care, visit behavioralhealthtech.com. Until next time, let's keep pushing boundaries and expanding access together.